So welcome everybody. Heather Woodbeck and myself, Ebo McDonald, the long-term care best practice coordinators for the Champlain and the Northwest LHINs, would like to welcome you to our first part of a three-part series on best practices in oral care. Today we're going to talk about how to perform an oral assessment in long-term care, the normal mouth. Please note that this presentation was previously recorded. There will, however, be time to answer questions at the end of the session. Everybody will be on mute until the end. There's two ways to ask questions, either by using the chat box or by asking over your phone lines. So I'd like to thank Paige Henry and Amanda Monette today for doing our presentation for us. So I'd just like to acknowledge that this is a partnership between the Dental Hygiene Program at Algonquin College and the Long-Term Care Best Practices Program. We did have funding through the Long-Term Care Best Practices Program through the Ministry of Health and Long-Term Care, as well as the Algonquin College Innovation Funding Grant. I'd like to really thank all the students for all their hard work and dedication in order to prepare this presentation, and I'd like to recognize Angela Noel for her leadership and coordination of the Oral Care Partnership.
Our presentation has two main objectives. The first is to demonstrate an ideal oral health assessment approach for residents in long-term care facilities. And the second is to illustrate normal oral health findings and the many oral health changes associated with aging. During the oral health status assessment, the following items are required. Gloves and a mask are to be worn by the assessor. A tongue depressor should be used to help control the tongue when attempting to thoroughly inspect the oral cavity. Using gauze will help take hold of the tongue when needed and remove loose debris from the tissues. A light source of any kind is also essential for proper tissue examination. Optional but very useful tools include a disposable mouth mirror that helps examine teeth and tissues at the back of the mouth. A headlamp for more direct light source is also very valuable. During the exam, the assessor should do the following. Introduce him or herself, explain what he or she is going to do, get residents' consent, seek continuous feedback, monitor body language, visual and verbal cues, and stop if the resident no longer cooperates. The following is a video that includes an effective approach to complete an oral health status assessment.
Ensure personal protective equipment is worn, so mask and gloves. You can also use a flashlight as a light source. You're going to ask the client to lay down in the chair, as well as to raise their chin. First thing to look at are the lips. You'll ask the client to open up. So next you're going to look at the cheeks. Look at both sides by retracting with your index finger. Also check the bottom of the lips as well as the top. If there's any full or partial dentures, ask the client to remove them prior to conducting the assessment. Next thing to look for is the palate. So you'll ask the client to lift their chin. So you're going to look in this region here. You'll ask the client now to lift their tongue to the roof of their mouth. You're going to look at the bottom of the tongue and the floor of the mouth in here. Next thing you're going to do is ask the client to use a popsicle stick to retract the tongue. So put your tongue to one side. Ensure that you look deep as far as you can in the back of the tongue. On the opposite side as well. Excellent. You can retract the cheek for better vision. In this region here is where oral cancer is more prominent. You can relax your tongue. You also look at the top coating of the tongue, and you can ask the client to say, ah, and excellent. So this is to look for the tonsils. You can also use the popsicle stick to depress the tongue. Gauze is also very helpful. You can relax your tongue on the gauze. Gauze is very helpful when retracting the tongue, so you can stretch the tongue as far as you want to look in the back region. Excellent. Next, we're going to check for saliva. So you take your index finger and you just rub gently on the side of the cheek. You'll check for the saliva and see if it's viscous or serious. Next, you're going to retract the lips again, and this is to check for the teeth and the gums. Do it to both sides and on the insides as well. And this concludes our assessment.
One thing we'd like to add to the assessment approach is the use of one finger applied to the outside of every tooth to assess for any loose teeth. The first step in the oral health assessment is to determine the type and amount of debris present. The presence of debris is not normal, but is often seen and must be removed on a regular basis. There are three main types of debris. Plaque biofilm is bacterial buildup in the mouth that may present on all oral tissues. It is soft, somewhat easy to remove, and appears white or yellowish in color. Food particles are often found in between teeth following meals. Both of these debris types can and should be removed daily by brushing. Calculus, also known as tartar, is long-standing plaque that has calcified and hardened over time. This type of debris can only be removed by dental professionals and is a contributing factor to oral disease. Calculus appears as chalky white to yellow in its initial stages and may become brown with stain or dark gray to black over an extended period of time. These are good examples of common debris presentation. Plaque and calculus buildup frequently begin in between teeth and at the gingival margin, as seen in the top left image. The top right image demonstrates extreme debris buildup that likely includes all three types of debris. The third image shows plaque biofilm buildup on gum tissue, an important assessment finding that must be removed promptly to protect these oral tissues. Next, the lips must be examined. The normal aging process results in the loss of fatty lip tissue, causing thinner lips with more wrinkles. At rest, lips should be touching to protect the oral tissues from drying out. The lips themselves may appear either moist, somewhat dry, or cracked. Dry, cracked lips are often seen during colder, drier months. Close attention must be paid to any lesion that presents on the lips. Some lesions, often seen in an elderly person, include freckles or sunspots that appear as dark, flat lesions, and vascular lesions resulting from dilated blood vessels. The bottom picture is a good representation of a venous lake, likely resulting from many years of smoking, found exactly where a cigarette is or was placed time and time again. This type of lesion may also result from many years of sun exposure. The top picture is a good example of what a freckle on the lip may look like. Although some lesions are normal, all must be examined for any changes in appearance. The next step is to take a closer look at the teeth themselves. There are many age-related changes in the dentition, including the following. Teeth generally present even in color with varying shades of yellow. Yellowing and staining of teeth is a normal aging process. Recession causing tooth root exposure is frequently witnessed and is considered the norm in an aging mouth. Missing and misaligned teeth are also normal. Heavily restored teeth are very common in an elderly mouth with various fillings, crowns, and bridges in place. Some teeth with amalgam or silver fillings may exhibit a bluish hue, which is also a normal finding. This can be witnessed on the top picture, more so on the left side. Signs of wear or attrition are also frequently seen due to years of chewing and grinding.
Next, the gingiva, which is better known as the gums, will be discussed. Healthy gingiva, like I said, is also known as the gums, should be pink in color and feel firm and moist to the touch. The papilla, which is the gum tissue between the teeth, should ideally be pointed. Over time, the papilla becomes blunted and or missing completely due to many factors associated with aging. The gingiva or gums may also appear pigmented, which is a variation of healthy gum tissue. And next, to look at the oral tissues. The picture on the left shows what healthy oral tissues or cheeks should look like. The three pictures on the right show common findings. Linea alba, which is a white line or lines on the cheek, is an irritation of tissue that is often related to cheek biting and clenching. It can be found on one or both cheeks. The second picture demonstrates tissue trauma. This can occur from cheek biting, and other sources. The last image shows a canker sore. Diet, biting, and genetic predispositions are some of the causes. And also to take note that any lesion that lasts more than 2 weeks must be looked at by a physician or dentist. And now we have the tongue. Many normal and healthy variations can be seen on or underneath the tongue. Typically, we should see a pink, non-coated tongue with a uniform appearance across the tongue. So firstly, here are some variations of normal. So a coated tongue results from a buildup of debris, bacteria, and dead cells accumulating between the taste buds on the tongue. And next we have a geographic tongue, which presents as red patches with white borders, as shown here in this photo. The presence can be exacerbated with stress and can be accompanied by complaints of a burning feeling. Avoiding acidic or sugar foods, liquids, can help reduce the sensation. Next, we have a fissured tongue, which presents as deep fissures or grooves on the top of the tongue. Often, client experiences the same burning sensation as geographical tongue, and is recommended that the client brush their tongue lightly with a toothbrush to remove debris daily. And also, it is important to brush the tongue twice daily to remove debris, especially in tongues that are coated in fissures. And then to talk about saliva. The saliva is a very important substance that helps defend all oral tissues against disease and destruction. It is for this reason that an assessment of the quality and amount of saliva present in a person's mouth is essential for determining one's oral health. When assessing a resident's saliva, assessors must note its amount and its consistency, qualities that are both placed on a continuum. You may detect a light, medium, or abundant amount ranging from watery to thick or sticky. Ideally, residents would present with a lot of watery saliva that naturally moistens tissues and protects teeth from decay. Some healthy mouths may show signs of a thick or light to medium amounts of saliva. As long as all the tissues appear moist to some degree, this is considered healthy. We have two examples representing both extremes in the saliva presentation continuum. On the left, we have an example of abundant, serous, or watery saliva that tends to pool in certain areas and is clear in appearance and renders the tissue slippery to the touch. On the right, we have a good example of what a dry mouth would look like. Notice the white, thick appearance on the saliva. These tissues are lacking moisture and would likely be sticky to the touch. Next are challenges to the oral exam. So if the resident refuses to open their mouth, one strategy used is to stroke the cheek. Another challenge is prioritizing assessment sequencing when faced with time constraints and/or resistive behaviors. Focus should be made on the RI-MDS section L, which includes debris, broken, loose, or carious teeth, inflamed gums, swollen or bleeding gums, oral abscesses, ulcers, or rashes. And these slides here are the references that we used for the presentation.
So thank you, Paige and Amanda. So I just want to say that we're going to now unmute the phone line, so you can either ask your questions or you can type them directly into the chat box. Also note that you were given a link for questions, and we've developed a page for frequently asked questions related to session 1. So you can go there, and we'll keep adding to that so that you can see all those questions and answers on an ongoing basis. Thank you very much.